Ma'am, can you share the screen?
Yeah.
You can start, ma'am.
Okay. Hi, everybody. Welcome to this class of toxicology on spinal poisons, cardiac poisons, food and miscellaneous poisons. So coming to the important questions that we'll be discussing today, we'll be discussing certain short answers, and the short answers include desensitization, tetanus and strychnine poisoning, the difference between them, strychnine poisoning treatment, about monk's hood, oleander poisoning, acute aconite poisoning, and also we'll be discussing about botulism, clinical features and treatment, and acetaminophen poisoning. Now coming to why choose Auricle and what is the app I have to offer to you. So there is various features in the app, including recorded classes, live classes, practical sessions, exam module, as well as hard copy book set. So you can make use of all these in order to prepare for your subjects. Now coming to the foundation class, there are going to be flexible learning here. You can accept the foundation classes anytime, anywhere, and revisit the topics as needed to enhance understanding as well as retention of all the topics. There are going to be expert instructors who will be guiding you throughout the subject. They'll be telling you what are important, how you need to focus, and how you need to approach the subject. Also, it is going to be very convenient for you to revise because you can revise at your own pace. You can sit wherever you're comfortable at and study from this app, which allows for better mastery of various subjects. Now coming to the live classes give you in-depth knowledge, and all the previous 10-year questions are going to be discussed here, and it will give you a fair insight as to what are the important questions that will be asked in the coming exams. The expert educators will guide you through the concepts. They'll also explain you about the answer writing skills, study plans, and so many more. Coming to the live classes, these are going to be interactive classes. There is going to be live doubt clearance, MCQ polls, Viva VOC, and so many more. Now coming to the express exam module. So exam module is curated in such a way that the entire syllabus is going to be completed in less than 20 hours. So it is comprehensively and effectively going to cover each and every subject. It is also going to help you with the answer writing skills. It is going to help you master the art of high scoring responses, be it writing an answer effectively. It is going to guide you through and through. The best educators in the field have a lot of teaching experience and will guide you in the same. There is also one-to-one doubt clearing session. This session is curated in such a way that all the essential topics are covered, and there is a student-centric approach that is taken. So every question, no matter how small, is valued and addressed by the dedicated educators to ensure comprehensive understanding of the subject. The aim here is to give you a thorough understanding about the subject. There is personalized attention given, and also a doubt clearance sessions are designed. It is designed in such a way that every small doubt, no matter how big or small, is going to get cleared in this session. It is a safe learning environment where you can resolve all your queries without the fear of judgment in a supportive and understanding setting.
Hello, ma'am. Hello.
సందీప్
Hello.
గారు ఏమైంది ఇది రావట్లేదా?
Okay, we can't see your screen, ma'am. From 10 minutes, 5 minutes. No, ma'am.
సందీప్ గారు మీరు అక్కడ లేరా?
Screen, ma'am. Both, ma'am. You are also no, I can't unable to see.
Ma'am, we are not able to see your screen even now. We can't able to see you, ma'am. సందీప్ గారు మళ్ళీ కనెక్ట్ అవ్వమని చెప్పాను లీవ్ అయ్యి. మ్యామ్ మళ్ళీ కనెక్ట్ అవుతారు. సందీప్ గారు.
Now
Hello.
now
Hello,
while
ma'am. చెప్పండి, ma'am.
Yes, ma'am. Now we can see you, ma'am. But could you please share your screen also once?
yeah. Now can you see?
Yes, ma'am.
From now
So
we
to
able
start
to
from
see.
the beginning, from where should I
Yeah,
start?
you have to start from the beginning, ma'am. Actually, we from beginning only we couldn't able to hear you, and also we're not able to see the screen also.
Okay, okay.
So start, ma'am.
Yeah. Hi, everybody. Today we'll be discussing about toxicology. We'll be discussing certain topics like spinal poisoning, cardiac poisoning, food and miscellaneous poisoning today. Coming to Auricle, coming to the questions that we'll be discussing today, we'll be discussing questions about desensitization, tetanus and strychnine poisoning, the difference between the both, strychnine poisoning treatment, monk's hood, oleander poisoning, and acute aconite poisoning. Also, we'll be discussing about botulism, clinical features and treatment, and acetaminophen poisoning. Coming to why choose Auricle, because it offers various features including recorded classes, live classes, practical sessions, and hard copy books. Coming to the foundational class, what do these classes have to offer? It offers learning, that is, students can revisit all the topics and watch the comfort of their home or wherever they're comfortable in. The expert instructions given to this by the educators give you a wide idea about the subject in depth. Also, it is going to be convenient for revision because you can watch this video any number of times. You can go back to it. You can watch it at a place of your comfort. Coming to the live classes, it gives in-depth coverage of all the important questions, especially the previous 10-year PYQs and the most anticipated questions. The experienced educators are going to tell you about study plans, about the answer writing skill, and so many more. These are going to be interactive learning sessions where there will be live doubt clearing sessions, MCQ polls, Viva OC, and so many more. Coming to the Express exam module, it is curated in such a way that the entire syllabus less than 20 hours. Answer writing skills are going to be taught. How you need to include diagrams is going to be explained here. How you need to put flowcharts is going to be explained here. And about the skill of actually writing a paper in such a presentable way so that you get extra marks. The expert educators give you a very good insight about the subject. There is also one-to-one doubt clearing sessions where a student-centric approach is taken, where the dedicated educators will ensure comprehensive understanding of each and every student. There is personalized attention given to each student. No matter how big or small the doubt, it is going to be taken care of. Also, it is going to be a safe learning environment where you can ask and resolve your queries without the fear of judgment, because the entire app is very supportive and student-friendly. There is also hard copy notes set which is available, which gives in-depth coverage of the past 10 years PYQs, the images, there are going to be flashcards, there are so many more. The book is very colorful and it also helps you in building up PictureSQ memory. Coming to the Q-Bank, there are 3 levels of Q-Bank questions that are available from beginner to expert. So the Q-Bank can be customizable according to the topic that you're studying. It covers MCQs of prof exams, NEET PG, as well as FMGE. Practical sessions are curated in such a way that the gap between the actual practicals happening in the and the time by when you go and give your exams are taken care of. It's bridged here. You are also going to get insights about how we need to approach Viva OC and what are the probable questions that can be asked during your practical exams. The subscription plans include the foundation plan, where will be given pre-recorded classes, live classes, expert exam module, practical sessions, and Q-Bank. Also, there are advanced learning plan, complete learning plan, and ultimate MBBS plan. Coming to the complete learning plan, the extra things that will be offered here are the hard copy note set and the one-to-one doubt clearing session. In the ultimate MBBS plan, it is for 4 years. So you're going to be covered through and throughout your MBBS. So coming to the topic per se, we'll be discussing about spinal poisons, cardiac poisons, food and miscellaneous poisoning today. And coming to the first question is about desensitization. So what is desensitization? Desensitization, the drug addiction, refers to changes in the brain that reduce the responsiveness to the effects of a drug over time, requiring higher doses to achieve the same effect. So for example, if a 5 mg of drug would allow a person to get certain effect, later to get the same effect, he'll have to take around 7 mg of drug and later maybe 10 mg. This process is called as desensitization, which will ultimately lead to the development of tolerance. So what is tolerance development? Desensitization leads to tolerance, where the brain's reward system becomes less responsive to the drug. So the individual needs larger doses to experience the same high. That is, the reward system in the person would become saturated. And he will not get the same high by using the drug. This is meant here. Coming to the neurochemical changes, the chronic drug use alters the brain's neurotransmitter systems, especially dopamine pathways, reducing the natural reward response and increasing the dependence on the substance for pleasure or relief. Now, the dopamine pathway is a pathway which is involved in this function. So, what is meant by altered receptor sensitivity? That is, prolonged exposure to a drug can lead to a reduction in the number or sensitivity of the receptors. Dopamine receptors are the ones which are what happens is that, as I told you in the previous point, it is a dopamine pathway that is involved in the development of tolerance. And dopamine is a drug that is involved. So dopamine usually goes and acts on certain receptors. Now, the sensitivity of those receptors comes down. And that is why the person becomes unresponsive and would require larger and larger doses in order to get the same high. That is meant by altered receptor sensitivity. Coming to increased risk of overdose, as desensitization occurs, individuals may unknowingly increase their dose, which increases the risk of overdose due to body's diminished capacity to handle the drug. Now, as I told you, larger and larger doses are required in order to reach the same high, right? But when larger doses required, apart from it giving high, the person will also be subjected to increased side effects of the drug. That is what is mentioned here. Coming to the impact on recovery, desensitization can make it harder for individuals to regain normal brain function during the recovery. What is the difference between tetanus and strychnine poisoning? So this will be the second question. So the clinical features of both strychnine and tetanus poison is almost similar. Now, coming to the history, whenever there is poisoning with strychnine, there won't be any history of injury. Coming to the onset, it is going to be sudden onset. Whereas in tetanus, there is history of injury always present. Maybe a wound, maybe a fall on an unsterile surface, maybe a fall in a forest area, where like this. And the onset of symptoms are going to be gradual. Coming to convulsion, all the muscles of the body are affected at a time, whereas all the muscles are not affected at a time in case of tetanus. A group of muscles, like for example, the jaw muscles are affected first, leading to lockjaw, and later some other muscles of the body will be affected. Coming to the lower jaw, in strychnine poisoning does not start nor especially affect the jaw. Whereas in case of tetanus, always starts in the jaw and especially affects the lower jaw. So the lower jaw is mostly affected in case of tetanus. Coming to the muscular condition, between fits, muscles are completely relaxed in case of strychnine. Whereas in tetanus, between fits, muscles are slightly rigid. That happens in tetanus poisoning. What is fatal period? 1 to 2 hours in case of strychnine poisoning. Whereas in case of tetanus poisoning, the fatal period is more than 24 hours. Coming to the chemical analysis, strychnine is found. Whereas in tetanus, no poison is found. Coming to strychnine poisoning treatment, strychnine poisoning is a medical emergency that requires immediate treatment due to its effects on the nervous system. So strychnine is mainly a spinal poison. It acts as a powerful neurotoxin causing severe muscle spasms, seizures, and respiratory failure. So whenever the doses of strychnine is too high, how it causes death? It causes death by muscle spasms, seizures, and respiratory failure. Coming to the immediate medical care that you have to give during a time of strychnine poisoning, it includes hospitalization. Hospitalization is very essential, and the patient should be treated in a critical care unit as much as possible. Coming to decontamination. So how do you decontaminate a person who has taken a strychnine? You can give activated charcoal. It is administered if the ingestion is recent, that is within 1 to 2 hours. If you give activated charcoal after like 3 hours, it is not of much use because already most of the poison that is ingested is taken into the body, it is absorbed into the body. Therefore, activated charcoal can be given only if the poison is taken within 1 to 2 hours. Gastric lavage may be considered in some cases, but only if it's done quickly, within 1 hour of ingestion. Same logic applies here also. If gastric lavage is done after 3 to 4 hours, because the absorption has already taken place, there is not much use. Coming to how to control seizures and muscle spasms. Seizures can be controlled by giving benzodiazepines. Example, you can give either diazepam or lorazepam. These are often used to control both muscle spasms as well as seizures. You can also give barbiturates in severe cases to manage convulsions. Now, coming to the supportive care that can be given to the person, oxygen therapy may be necessary to ensure adequate oxygenation, especially if respiratory muscle paralysis occurs. Because if the respiratory muscle is paralyzed, the respiration process becomes difficult. Okay, so that is why oxygen therapy is mandatory. Intubation and mechanical ventilation may be required if the respiratory failure develops. That is how you'll be able to maintain proper SpO2 and oxygenation in the tissues. Coming to the specific antidote, there is no specific antidote for strychnine. So the treatment focuses on symptom management and supportive care. You look into it that the airway, breathing, circulation, fluid status, and temperature, all these are properly regulated. Coming to the other measures, muscle relaxants like Curare and dantrolene can be given, and it may be used to alleviate the muscle rigidity and prevent the complications. So whenever Curare is given, it causes a relaxation of the muscles. That is why it is going to benefit the person. Now coming to monkshood. What is monkshood? You can see the image here, right? This beautiful violet colored flower is nothing but monkshood. So monkshood usually grows in parts of Himalayas. All the parts of the plant are poisonous. Coming to the root, it is a important part of the plant and it means aconite and many other alkaloids. So the other name of monkshood is nothing but aconite. So in the exam, if they give you the question as monkshood, you have to write about nothing but aconite. So here, this brown color, these are the roots of aconite, and these contain so many alkaloids, including aconitin. And this is the most poisonous part of the plant. Now, coming to the explanation about dry root. It is conical and tapering at the end, and it is brown in color. If you look at the root here, you can see, right? It is conical. See the image? It is conical and it is brown in color. Also, the internal color of the root is white color. And when it is exposed to air, it becomes pink in color. And the taste of this root is going to be sweet. What are the signs and symptoms? When it is rubbed on skin, it produces tingling and numbness sensation. The pollen, whenever it comes near the eyes, there is pain and swelling, burning sensation from the mouth to stomach, and tingling and numbness in the mouth, tongue, and pharynx is also seen. Nausea, vomiting, diarrhea is seen, and also the person complains of increased thirst. There is also headache, giddiness, subnormal temperature. Limbs are very, very weak. The person is unable to walk. There is also hippus. Highlight this point. What is hippus? Is the pupils alternatively contracting and dilating, but remain dilated at a later stage. So this is called as hippus. Initially, to start with, the pupils will be alternatively contracting. That is, there is miosis and mydriasis, but at the end, there is only mydriasis. The pupils remain in a dilated state. Vision, there is diplopia, that is the person experiences double vision. There is also cardiac arrhythmia with AV block that is seen. Coming to treatment, gastric lavage can be tried with warm water and potassium iodide. That is how the poison can be eliminated from the body. Atropine 0.5 to 1 milligram can be given. This is going to antagonize most of the symptoms. Activated charcoal is given. So what is the function of activated charcoal? It is going to prevent the further absorption of the poison into the body. Whatever unabsorbed poison is there in the intestine and the stomach, activated charcoal helps to absorb it on the surface of it, and hence prevents the absorption into the bloodstream. And symptomatic treatment, where airway, breathing, circulation, electrolytes, everything is taken care of. In the post-mortem appearance, what is the classical feature? Classical feature is that of asphyxia. This is seen. Coming to the next question, it is about oleander poisoning. So this pink color flower here is nothing but oleander. So a lot of people might have this in their garden, and somebody, a small kid, unknowingly might just put his mouth into the flower or pick it and eat it off. That's why knowledge of forensic medicine comes handy, to know at least what are the poisonous substance and not keep it around us at least. Okay, so all the parts of the plant are poisonous. Now coming to the active principles, what are the active principles? Active principles include oleandrin, nereoside, folinerin, and rosagenin. Coming to the signs and symptoms, there is difficulty in swallowing, there is abdominal pain, vomiting, profuse frothy salivation is seen around the mouth. There is also diarrhea, weak pulse, reduced blood pressure. And coming to heart, what are the symptoms seen? There is going to be AV block and ventricular fibrillation. Later, these two, AV block and ventricular fibrillation, will lead to death and even respiratory paralysis. Pupil is going to be dilated. Coming to the skeletal system, there is going to be muscular twitching. That is, the muscles are going to twitch. There's going to be tetanic spasms and lockjaw. That is, the person won't be able to move his jaw. And also there is going to be respiratory paralysis, which makes the person difficult to breathe at a later stage. And this can also become one of the causes of death. The fatal dose is around 15 to 20 grams. And the treatment includes stomach wash and symptomatic treatment. Stomach wash can be done with lukewarm water, or you can also use potassium permanganate. After which you have to give symptomatic treatment. Now coming to the next question, we'll be discussing about acute aconite poisoning. So what are the signs and symptoms? When it's on the skin, it produces tingling and numbness. So aconite, when you rub it on the skin, it produces tingling and numbness sensation, and the pollen causes pain and swelling in the eyes. There is also burning sensation from the mouth up to the stomach. So wherever it comes in contact with the gastrointestinal tract, throughout there will be this burning sensation because it kind of corrodes the mucosa. There is also tingling and numbness in the mouth, tongue, and the pharynx, nausea, vomiting, diarrhea. So these are the GIT symptoms as well as thirst. The person experiences intense thirst. The other symptoms include headache and giddiness, abnormal temperature. That is the temperature of the body. The person's body is thermic. The limbs are weak. Walk. Also, there is hippus. That is, pupils alternatively contract and dilate, remain dilated at the later stages. Vision, there is going to be diplopia that is seen. That is, a person experiences double vision, and also cardiac arrhythmias is seen, and AV block. So cardiac arrhythmias and AV block are the cause of death. Now coming to the treatment. How do you treat? Initially, you can give gastric lavage. That is, with warm water and potassium iodide, you are going to do gastric lavage. So what is the use of gastric lavage? If done within 3 hours, it helps in removing all the unabsorbed poison from the body. You can also give atropine 0.5 to 1 mg. Activated charcoal can be used, and symptomatic treatment can be tried in the person. Symptomatic treatment in the sense, those treatment that aims to maintain the respiration, airway, and breathing in the person. What are the post-mortem appearance? The most common one is asphyxia. So signs of asphyxia are seen. Coming to the next question, we'll be discussing about botulism, the clinical features and treatment of botulism. So what is botulism? This is a question from food poisoning, right? So botulism is caused by Clostridium botulinum. So this is a bacteria that is causing botulism. So Clostridium botulinum is found in tinned meat, fish, and even fruits. So the exotoxin paralyzes the nerve endings by blocking the nerve impulses at the neuromuscular junction. So this is the mechanism how the Clostridium botulinum will bring its action. So it produces an exotoxin which will paralyze the nerve endings. That is how botulism is caused. Coming to the action, it is selective with the cholinergic fibers of the autonomic nervous system. What are the signs and symptoms? In the GI, there is nausea, vomiting, abdominal pain, distension, and pain. So most of the symptoms are the GI symptoms that are seen. Apart from this, there is also sore mouth and dryness. Apart from this, there is dysphonia, diplopia, ptosis, and blurring of visions. Remember that the eye manifestations are also there. Like diplopia, it is the person experiencing double vision. Ptosis, that is weakness of the upper eyelid, and then there is blurring of vision. He won't be able to see the objects clearly. Coming to the other features, there is which is descending bilaterally, and it is symmetric motor paralysis. Coming to the other things, the respiratory insufficiency, there is going to be urinary retention. So these are the symptoms that will be seen. Coming to the treatment part, gastric lavage can be tried, activated charcoal can be used, and a purgative can be tried. So gastric lavage and activated charcoal are the two things that can be tried in case of poisoning with ingestion as the route of poisoning. So if a gastric lavage or activated charcoal is given within 3 hours, it prevents the further absorption of the poison into the body. That is how it brings its action. But if you give this after 3 to 4 hours, there is no use because the poison is being already absorbed into the body. You can also give purgative. Purgative is a process by which you make the person puke out the unabsorbed poison. You can give IP pack powder here. Coming to the whole bowel irrigation, it can be tried by giving polyethylene glycol. So when you give polyethylene glycol, it is going to irrigate the whole bubble and the poison can be removed. Also, you can give botulinum antitoxin. 1 vial can be given by slow IV route, and this can be given by mixing it with normal saline. And also, there are botulism immunoglobulins that are there that can be given, which will reverse most of the features. Now, coming to the acetaminophen poisoning. So, what is acetaminophen? It is nothing but paracetamol. Enzyme metabolizes paracetamol into N-acetyl benzoinomine. So the glutathione and sulfhydryl compounds detoxify the substance, but overdose causes central lobular liver necrosis. So basically what happens, this metabolite that is formed is going to be detoxified by glutathione. So what is glutathione? That is a substance in the body which will act with the free radicals, which will counteract with the free radicals and any of the poisonous material that comes into our body and detoxifies it, hence making us live properly. So what happens whenever this paracetamol poisoning occurs, the amount of NAPB formed is so much that all the glutathione will get saturated. So when there is no more glutathione, this metabolite goes into the liver and causes central lobular liver necrosis. That is how paracetamol brings in the bad effects, and finally liver failure occurs and warrants a liver transplant. Coming to the fatal dose, it is around 0 to 5 gram. This is the fatal dose. Coming to the symptoms, initially there is going to be anorexia, nausea, vomiting, and the abdominal pain. This abdominal pain is the most characteristic symptom that is seen. Also, there is diaphoresis, that is increased sweating. There is hypotension, tachycardia, and dyspnea. After 1 to 2 days, discomfort disappears. That is, a person is symptomatically going to feel better. Now, after 2 to 4 days, what happens? Again, there is vomiting, jaundice, hepatic pain, bleeding, and hypoglycemia, confusion. So these are the symptoms that will be seen after a period of 2 to 4 days. Later, there is metabolic acidosis and coarse flapping tremors that are seen. So if you ask the person to stretch his hands like this, the hands are not going to be straight. The hands are going to move like this. This is the meaning of coarse flappy tremors, and this is nothing but asterixis. The name of this is asterixis. This is important. Put a star note here and remember asterixis. There is also a renal failure that occurs at a later time. There is renal papillary necrosis, which occurs after 24 to 72 hours. That is, in a time frame of 1 to 3 days, there is renal papillary necrosis, which will ultimately lead to renal failure. That time, the further excretion of this metabolite doesn't happen, and that will warrant a hemodialysis or a peritoneal dialysis. Now, coming to the treatment, gastric lavage can be tried and activated charcoal can be used. So basically, in any of the poisoning that we've mentioned till now, we can use gastric lavage and activated charcoal. But remember, only if it is within 3 hours, it will show lots of benefit. Also, N-acetylcysteine can be tried. N-acetylcysteine is a specific antidote. That is 70 mg per kg is given every 4 hours and maximum of up to 18 doses can be given. Remember, this is a specific antidote in case of poisoning with paracetamol. Also, methionine can be used. Methionine increases the glutathione synthesis. That is how, if the glutathione levels are more, it is going to bind with the poisonous metabolite. That is why our aim here should be either to reduce paracetamol concentration or to give N-acetylcysteine, which will reduce the amount of the toxic metabolite, or give methionine so that the glutathione level replenish and it binds with the metabolite and helps the excretion of it. You have to correct acidemia. So any paracetamol poisoning brings in a state of acidemia. It has to be corrected. Hemodialysis has to be done in the later stages when the blood level of paracetamol is too high, and symptomatic treatment can be done where airway, breathing, and circulation is taken care of. Coming to the post-mortem appearances, there is acute central hepatic necrosis that is seen. There is also acute tubular necrosis of the kidney and myocardial necrosis. The most important one is the acute central lobular hepatic necrosis that occurs in the liver. Now, we'll go and solve certain MCQs related to this topic. So I'll be a few MCQs on this topic of spinal poison, cardiac poison, food poison, and miscellaneous poison. And I have discussed about it in certain questions now. No, we'll look at how much we can remember from it. Okay. So the first question is, which of the following substances is commonly associated with spinal poisoning and can lead to paralysis? It's a single correct answer type of question. So try guessing the answer. They're talking about spinal poisoning and they're asking which one can lead to paralysis. The answer is curare. It acts by blocking the transmission of the neuromuscular impulses, and that is how it is cause the paralysis. When a neuromuscular impulse is not transmitted, the action potential doesn't generate, there is no effect on the muscle, and therefore paralysis develops. Hence, Curie would be the correct answer here. Now, coming to the second question, which of the following substances is known to cause arrhythmia and cardiac arrest when ingested? It is also a single correct answer type of question. Look at the options here. They have given digitalis, aspirin, acetaminophen, and ibuprofen. We have discussed that digitalis, nicotine, oleander, all these are the cardiac poisons. So the cardiac poison which would cause arrhythmia and cardiac arrest would be digitalis. Whereas aspirin, acetaminophen, and ibuprofen mostly affect on the liver. Coming to the third question, which of the following is a common cardiac poison that affects the potassium levels and lead to hyperkalemia? Look at the options. There is cocaine, there is amiodarone, beta blocker, and potassium chloride. What would be the answer in this question? You can use a common sense for this question. It is such an easy question. They've asked which of these poisons leads to hyperkalemia. What is hyperkalemia? It is increased potassium in the blood. And you have an option here, which is potassium chloride. What does potassium chloride do? It increases the level of potassium in the body. So the right answer here would be potassium chloride. Coming to the fourth question, which is the primary mechanism of action of strychnine that leads to its toxic effects? It is a single correct answer type of question, and the answers, the options that are given are inhibition of acetylcholinesterase, blockage of GABA receptors, stimulation of serotonin receptors, inhibition of sodium channels. So what is the correct answer here? Is it inhibition of acetylcholinesterase? No. What inhibits acetylcholinesterase? Any of the OP compound, organophosphorus compound, inhibits acetylcholinesterase. So that is not an answer here. So what would be the answer? The right answer would be option B, blockage of gamma aminobutyric acid or the GABA receptors. Now coming to the fifth question. What is the primary alkaloid found in Nicotina tabacum that is responsible for the addictive properties? And the options are caffeine, nicotine, theobromine, and morphine. This is also a common sense question. Where is caffeine found? Caffeine is found in coffee, right? Where is nicotine found? Tea. And see the name of the plant that is mentioned, Nicotina tabacum. So what is the answer here? Nicotine. So there are certain questions which test your common sense. The answer is going to be there in the question itself, and this is one such question. What is the primary mechanism of toxicity in paracetamol overdose? Single correct answer type of question. So you have four options: direct hepatic necrosis, depletion of glutathione, renal tubular injury, or cardiovascular collapse. So what is the answer? We read about paracetamol poisoning recently. No, we did not see any of the cardiovascular features there. So option D is eliminated. Among the other three, renal tubular injury occurs, but renal tubular injury occurs only at a later stage, after 24 to 48 hours. So that cannot be answered because they asked primary mechanism of toxicity. That should be the immediate one. Direct hepatic necrosis, option A. Is it right? No. Hepatic necrosis also occurs at a later time. What is the primary mechanism? It is a depletion of glutathione. So usually glutathione binds with the toxic metabolite of paracetamol and helps in the excretion of paracetamol. But here what happens? Glutathione reserves are depleted because it binds and now there is no glutathione available. That is when all the metabolite starts doing its action. Therefore, depletion of glutathione is the important factor. Which of the following symptoms is commonly associated with acute paracetamol toxicity? So this question also has a single choice as correct answer. Coming to the options. The options include severe headache, abdominal pain, rash, visual disturbances. So what is the most common feature seen? When I was explaining the question, I told you all the GIT features of anorexia, vomiting, abdominal pain are all seen first. Among those, abdominal pain is the most commonly associated symptom. So that is going to be the answer here. Coming to the last question, what is the recommended antidote for paracetamol overdose? The options include N-acetylcysteine, activated charcoal, flumazenil, and atropine. What is the answer here? Is it activated charcoal? You can give activated charcoal, but it is not an antidote. It is only going to improve the person symptomatically. That is, it is going to prevent the further absorption of the drug into the body, therefore symptomatically making the person feel better. They're asking you antidote. So every drug can have only one antidote, a particular drug which will counteract the symptoms. So what is the answer here? It is N-acetylcysteine. It binds with the metabolite, the toxic metabolite helps in the excretion as well as increases the level of glutathione, which will further help in treatment of poisoning. So these were the 8 MCQs that we saw in this chapter. I hope you have got a thorough idea of the chapter. That's all we have to discuss today. I hope you enjoyed the class. Thank you.